So I'm here with Jessica to do a toe touch movement screen. So this is going to test for flexibility and any tightness, to see if there's any tightness anywhere in like her hamstrings and hips. So I'm going to go ahead and ask her to put her feet together, lock her knees, and go ahead and try to touch her toes. What you're trying to see here and look for is, one, if she could touch the ground, and from this angle, as we ask her to move, you could see if she's rounding her back, maybe using it as compensation, or if she's hinging well at the hip. She does a pretty good job of keeping her back straight, bending at the hip, not compensating too much. And then after seeing all four sides, if you want to get more of an individualized look, you could ask her to go ahead and lie on the ground and do an asymmetrical leg lift. So you get like a PVC pipe and line it up with their knee, and then you ask them to keep their toes pointed up, raise one leg at a time. What you're looking for here is to see if, one, she clears the pipe, and you're also looking in the leg that's on the ground to see if there's any compensation, as if it comes up, if the toes point outwards, or if there's any movement in the other leg. As you can see, her leg comes up just a little bit. This could be for tightness in her hamstrings, maybe in her psoas, or her glutes. A simple, quick way and easy way to fix this is to ask her to foam roll. We could go ahead and ask her to get a foam roll and roll out her hamstrings. And what you want to do here is roll it back and forth, not too fast, not too slow. See if you hit any tender spots or any trigger points. If you do, you want to go ahead and sit on it for a few seconds. Then also roll out your gastrocnemius, and especially behind the knee. This is a really tender spot that could get tight. So we're going to ask her to do one leg and then the other. And then once they have done this, you could go ahead and ask them to do the movement screening again, which we'll go ahead and do after she's done. You could also use a tennis ball or a softball or baseball if you want to get a little bit more of a in-depth or a little stronger of a rolling out. So we're going to go ahead and ask her to do the same leg lift one more time. So go ahead and raise one leg. And here you're just trying to see if maybe with just that simple tweaking, you could see that it changes and her tightness is a little better. She's more flexible, clearing the bar just a little more. So from here, then, you apart from rolling out, you could also do some glute activation work. Just get the glutes fired up. So we could do this with a simple glute bridge. So we could go ahead and ask her to do about 5 of them just to get her glutes activated. You're looking to see if her back is straight when she goes up. You could go ahead and you want to feel this in your glutes, not in your hamstrings or your lower back. If you do, that's a simple sign of telltale sign that there's tightness somewhere else. You don't want to feel this in your hamstrings or lower back. Then from here, once you see that they've mastered this, you could also make it a little more complex by asking them to go on a bench, or in this case the couch, and putting their upper back on the couch. So they put their upper back on the couch, and here it's the same thing. You want to have your feet shoulder width apart just about, and toes pointed out, and then just go up. And you want your back to stay straight. You don't want any curvature in your back, because that will then aggravate your lower back, and you're not looking to do that. You're just looking to activate the glutes, see if there's any tightness in the hip flexors. You could also make this a little bit more difficult by adding weight, maybe a plate or something and hold on to it, put it on your stomach. You could also maybe put like a dumbbell or something at your feet and just change the angle of your feet with it. So once they do that, then you could just ask them to do the toe touch assessment again. Just go ahead and touch your toes. So you can see here that there's good flexibility. There's not too much compensation going on, which is what you want to see. And overall, her flexibility did get a little better just by its quick, easy, simple things. So, thank you.